Good evening, everyone. We're just going to let everyone come in from the waiting room. And we'll get started in a minute. Hi, everyone. We'll get started in a minute once the waiting room is, everyone's come in from there. While we wait for everyone to get in, before we start this evening's seminar, I just wanted to remind everyone that, or you may remember that we had to postpone November's seminar, and we now know that we'll be able to have that seminar. The rain check will be in February, so that'll be the third Tuesday of every month, the 18th. So if you are looking forward to learning about behavior medications in horses, then we'll have that in February. And we're always taking recommendations. We usually plan, we planned a little bit for the coming spring, but we're always taking recommendations. If anyone has any requests, you can always email us or share your thoughts during the seminar. And we always record the seminars as well. And then if you've registered, we'll email the list, the kind of summary, and then a link to the recording. And that's all of the past seminars are in a YouTube playlist, so you can watch those on, we're trying to get basically any topic you can think of having to do with equid care, management, medicine. So that's a pretty good list we have going there. Dr. Erin Goodrich is our speaker tonight. She has given one other seminar on donkeys. That one was called Donkeys Are Different. And this time she'll be focusing a little bit more specifically on emergencies in donkeys. She's for sure a donkey expert. She is a veterinarian, of course, and she, after being in private practice as an ambulatory large animal practitioner for a while, she came back to Cornell and she works in diagnostics. She's a specialist in preventative medicine. And she has been doing that for a few years and is now, I believe, I want to say the associate director of the Diagnostic Center at Cornell. And if you've ever sent a sample of anything really to Cornell, then she's probably she's worked with you, whether you knew it or not, probably. And so her kind of special interest area is donkeys, both clinically and then also personally, I would say. She has 4 of her own. She's often a speaker at the Donkey Welfare Symposium, and she also does a lot of research with donkeys. So she's going to share some expertise with us this evening, and thank you very much, Dr. Goodrich.
All right. Well, thanks, Dr. Goodale. That was a very kind introduction. Thank you for joining us this evening. And it is my pleasure to be here to talk to you about donkeys because I always love to talk about donkeys. So I am going to discuss emergency problems with donkeys. And while many emergencies that occur in donkeys may be similar to those seen in horses, like lacerations and things of that nature, the focus of my talk tonight is really going to be a discussion on those things that are more unique to donkeys in emergency situations. So I will talk a little bit about the clinical assessment, some important information that you'll need to know about donkeys, really before you can even identify an emergency as an emergency. So I'll talk about donkey behavior because that's super unique and critical to understanding and also very different from horses. And then I'll talk a little bit about different forms of restraint and sedation and things like that that might be necessary in emergency situations, go over the temperature, pulse, respiration, that kind of thing. We'll talk a little bit about blood work and just some specific aspects of blood work that might be important in emergency situations with donkeys. And then I will go over some important and unique aspects of donkeys by body system in emergency situations. And then finally, I will wrap up with just a few important tidbits about euthanasia in donkeys. So I start almost every talk I give about donkeys with this picture. And I'll thank my colleague, a true donkey advocate and expert, Dr. Nora Matthews, for sharing this picture with me several years ago, because I really think it's a great one to highlight some important aspects of donkey behavior. So this is a virtual meeting, and therefore I can't really interact very well with my audience, but yeah, I'm just sitting here in my office talking to myself. But usually when I show this picture in front of an audience, I ask what they think about this donkey. You know, what's the best word to describe this donkey's behavior in this picture? And inevitably, I usually get at least several people that say stubborn. So I'm guessing that maybe some of you out there would probably think the same thing. If you've ever worked with donkeys, or you own donkeys, or even if you've just kind of pictured donkeys in your mind, you've likely pictured a scenario similar to what's happening in this picture. And we're going to come back to this picture in a few moments. So first off, we need to have a really solid understanding of donkey behavior if we're going to recognize a donkey who's having an emergent problem. So it's necessary to kind of take a step back and think about it. Today's domestic donkeys all evolved from the African wild ass, specifically the Somali wild ass that's pictured here. And this paper that I cite down in the bottom left of your slide it basically demonstrates that donkeys were domesticated by humans in East Africa about 7,000 years ago, which is just mind-blowing. That's about 3,000 years before people domesticated horses, just to put that into perspective. And so donkeys truly have helped to transform pastoralism, trade, really the world as people knew it at the time. And to understand donkey behavior, we really have to go back to their desert origins, because that's kind of, it's shaped everything about them, and it's crucial to understand. So as you can see, they came from these vast arid lands, this vast arid landscape in Northern Africa. And that's what shaped their social structures. It also shaped a lot about their nutrition and nutritional needs and things like that too. So food and water is very scarce. As you can see by this picture, they had to evolve to be both grazers and browsers. And they evolved to basically survive on really low nutritional forage with very little access to water. They had to eat little amounts all throughout the day and travel many miles or many kilometers each day in order to meet those needs. And clearly the landscape just wasn't something that could support a large group or a large band. It's not like the grasslands where horses evolved and formed large bands. So with donkeys, instead, their social structure is one that is basically where males form territories. They live by themselves for the most part, and they kind of form a territory around a water hole. And then females kind of live in really small groups, maybe with this year's offspring and perhaps last year's offspring. So small group of 2 or 3. If you live on your own or in a very small group, you can imagine that running away from a predator doesn't make a lot of sense, because you're likely going to get picked off. You're also going to be running away from your territory and your resources. So that doesn't really make sense. So donkeys don't show much in the way of pain or fear in the same way horses do, because they evolve these different social structures. They have a heightened fight response rather than a flight response. So rather than running away, they tend to activate more of a fight response. So again, in a desert, running away doesn't work. You're likely going to get picked off. And therefore, donkeys have a greater tendency to kind of face their threat head on and work to actively remove it. They might have a really brief flight response, but it looks different from a horse. So it might be something much more subtle, maybe just a turning of the head or a stepping sideways. But intuitively, their fear response is oftentimes just freezing in place. With horses, everyone kind of worries more about getting kicked, maybe with the hind feet. With donkeys, if you're perceived as a threat, it's more the front feet, the teeth, that you have to worry about if you trigger that fight response. So they tend to demonstrate that more with stamping, pawing, striking out, head tossing, biting. And one of their favorites, just leaning into you and really, kind of smushing you, if you're deemed a risk to them, a threat. So quite a bit different than horses. So now back to our donkey friend here, the one that in this photo, 4 people have decided needs to step on a scale, need to get a weight on this donkey, needs to get on this scale. So does he look stubborn? Remember, they're not horses. So don't read their cues on a horse scale, which we all probably have a pretty good vision of in our mind. If you learn instead to read the body language and expressions of donkeys on a donkey scale, you'll understand that this donkey is probably actually terrified. He probably thinks he's about to be pushed into a deep black hole, right? If this were a terrified horse, we can all imagine what we'd see. We'd see big expressions. The horse might try to rear up or spin around. The eyes would be wide. We would all recognize that as a fear response. But please believe me when I tell you that this donkey is also probably terrified, and understand that you just need to read the donkey expressions on the donkey scale. So donkeys are neither stubborn nor stupid, in my opinion. And actually, there is some literature out there that shows that they're actually faster problem solvers than horses in several studies conducted by the UK Donkey Sanctuary. So they have a natural propensity to freeze when they're threatened or frightened, and that calm, stoic disposition has led to this branding, which I'm constantly trying to bust. Okay, so here are just a few examples of some of the subtle changes in facial expressions that can indicate fear or stress in the donkey. But these signs can vary by individual, as you might imagine, right? Donkeys are individuals too. But some signs to look for can include, tightening or clamping of the nostrils, tension around the muzzle, the chin, the lip area. So you might see an increased number of kind of wrinkles in that area. Maybe a change in the shape of the eye and that upper eyelid, maybe a widening of the eye. So you might actually see the white part of the eye, the sclera. This just all means that veterinarians, we have to rely on information from astute owners and handlers. So you as owners and handlers have to really relay that information to your veterinarian. And there are all sorts of signs of pain and illness in donkeys, but most of them are quite subtle. And so here are just, some of them that I could think of. You might, and commonly this is all we see, but you might just recognize a sick donkey as a donkey who's kind of acting dull. The dull donkey, the depressed donkey, whatever you want to call it. They might have a lowered sort of head carriage or maybe fixed ears that don't seem as responsive as usual. Maybe their ears are usually moving all over and they're just fixed. Maybe they're lying down more than usual or less than usual. Maybe they're lying down in different areas of their paddock or at different times of the day. You're not used to seeing them lying down, and all of a sudden you're seeing them, in the afternoon, and they don't usually lie down like that. It's just these really subtle things we have to kind of take owners seriously when they talk about them. They might even have some tail twitching, kind of the base of their tail might be vibrating up and down. That can be indicative of pain. I've seen that in a donkey with laminitis. Or my personal favorite, because it's so unique and it's so donkey, is the third one down on the left, sham eating. And that's actually where donkeys do this wonderful job of fake eating. So especially in front of strangers when they're sick. Again, these are prey species and they've evolved, they don't want to look sick. And so it's quite remarkable, but they'll actually pretend to eat. So a reliance on a complete history, astute observations is absolutely essential. A dull donkey is an emergency, and I'm going to repeat that probably many, many times throughout this talk. And that's because a dull donkey is usually not eating or not eating much. And we'll talk later about why that is definitely an emergency in a donkey. All right, so when it comes to the physical examination, once you've kind of identified a donkey as possibly being in an emergency type situation, a physical exam should proceed in a very similar manner to that of the horse. But here I've listed the normal ranges for the heart rate or pulse, the respiratory rate, and the rectal temperature for horses compared to mules, and also compared to both adult donkeys and young donkeys. The main differences, really, the main takeaways are that donkeys tend to have just a slightly higher respiratory rate, a slightly higher heart rate, and sometimes their temperature runs a little lower. Not huge differences, but just, some differences to note. It's also really important to mention that although donkeys spend their lives in the wild in really small groups or sometimes on their own, as I already mentioned to you, in captivity, we see donkeys form really tight bonds with companions. There's at least one study out of the UK, probably more, who have looked into this and found that when donkeys, horses, and mules are housed together, it does appear that they prefer to associate with members of their own equid type. I guess that's not really that surprising. But what we also have to consider is the fact that death or removal of a bonded companion can be really traumatic and stressful, and can lead sometimes to anorexia in donkeys. And unfortunately, as I already alluded to, and I'll talk more about, anorexia in a donkey can be life-threatening due to this propensity that they have to develop a condition called hyperlipemia. So it's a huge concern. And in addition, if you have to refer a donkey into a hospital, it's wise to send it along with its bonded companion for company. So oftentimes the stalls in many veterinary hospitals are designed for horses. So smaller donkeys often can't see even over the door. And that's a little too much like solitary confinement if they're not with a buddy. And it can be really stressful on the donkey, and that can make the whole issue that you're dealing with that much worse. So that picture on the left shows a nice stall design that would be great for donkeys, but that's not a design I see in most veterinary hospitals. When it comes to restraint methods for donkeys, a lot depends on how used to being handled the donkey is. It's very important to establish trust with a donkey. It goes a long, long way. If you're a donkey owner, encourage your veterinarian, your farrier, whoever's going to be doing any sort of procedures on your donkey to establish that trust. It's nice if they can sort of sandwich a negative experience like vaccine administration or whatever in between some positive experiences. So you might have the veterinarian or the farrier or whomever give the donkey a treat, or if the donkey really likes butt scratches or ear scratches, kind of do that when they show up for the visit. Do it again for just a few minutes, kind of at the end of the visit. Take just a little extra time. And donkeys who appreciate ear scratches, man, those go a long way to developing trust. And patience. Patience is an absolute necessity when you're working with donkeys. You just have to have patience. And so anyone that you have working on your donkey has to have patience. It can be useful to approach donkeys at their face, which makes sense. If they have a bonded companion, it's great to have that bonded companion kind of in close proximity. If you're doing a procedure on the donkey, it can kind of alleviate some of the stress. Make sure that the area you're working in is well lit. Open up doorways, offer food incentives if that's appropriate. Whatever you can do to try to make it a positive experience and not super scary. Twitches. So I absolutely never, ever, ever would I ever allow an ear twitch to be used on a donkey. If you're going to use a nose twitch on donkeys, just realize that there might be some mixed results. Sometimes it might work okay. Other times it may not. So if you are going to use a twitch to help with a specific procedure, maybe for a blood draw or a quick injection or something like that, Dr. Tex Taylor, the late mammoth donkey expert from Texas, advised that you use the humane twitch. That's what's shown in this picture. So this type of twitch compresses the lips from each side rather than producing that twisting grip that you get with the chain or the rope loop twitches on the single handles. Since donkeys often have much smaller and even sometimes more muscular upper lips, it's more difficult to keep that chain or rope twitch on the donkey and to control the pressure appropriately. So if you're going to use a twitch, this is the one I would probably use. Okay, so if a donkey is used to being handled, then another method of restraint is just the supportive head hold, as shown in that top left picture. That works really great for donkeys who are kind of used to being handled. You can, of course, consider tying a donkey. If you do tie a donkey's head, it often works pretty well to tie it a little high and pretty short, kind of similar to the way we might tie a cow. So that tends to work fairly well with donkeys in most situations. In some situations, you can even sometimes squeeze a donkey, apply a little pressure with a gate or a panel. Sometimes that works. And in some situations, you can consider taking away a foreleg for the purpose of either examining the lifted foot or as a means of restraint of the donkey for examination or other, therapeutic procedure, whatever you have to do. And if the donkey is used to being handled and enjoys ear scratches, I already mentioned that, you might consider using that for a brief procedure too. My daughter is demonstrating that in the bottom right-hand corner with one of my donkeys who nearly just, goes into like the happiest state ever when he gets ear scratches. But if the donkey's not used to being handled, and it's an emergency situation, sedation obviously might be required. And in that situation, you want to administer sedation early, before the donkey gets worked up, because then the drugs won't work as well. So if sedation's indicated, it's indicated early on. So a little bit about sedation. In an emergency situation, sedation absolutely is necessary. When you have to perform a procedure on a donkey that's not used to being handled, I totally get that. I do think, though, that we rely on sedation in donkeys as a crutch way too often in situations when we really ought to be putting more time into training. So, for instance, when we're dealing with general foot care of donkeys, we know the farrier's got to come every 8 weeks or whatever. It's on us as owners to train our donkeys so that they can be handled by the farrier. And that's it. That could be a whole other talk entirely. So I'm not going to spend time on that, but I just kind of want to point that out. Because sedation's not without risk, and so we want to minimize it if we can. But when it comes to sedation in donkeys, we do rely on very similar drug protocols that we use in horses. So we often reach for what are called alpha-2 agonists like xylazine and titomidine, and they work beautifully in donkeys. The dosing scheme is very similar for donkeys. But for mules, you might have to actually bump up the dose of those alpha-2s by about 50% to get the same effect. So that's worth knowing. The oral gel form of dormosidane that I've shown here in that bottom picture can also be used in donkeys at the labeled dose used for horses. It seems to provide good sedation in donkeys, seems to work well. You do have to make sure that A, they don't spit it out because they're really sneaky and they do that. And B, you've got to wait probably at least 40 minutes before it takes full effect. So just realize that. When we talk about anesthesia with ketamine, I just want you to realize that donkeys metabolize ketamine much more rapidly than horses do. So using that xylazine for sedation and ketamine for induction likely won't provide enough time for most procedures that we need to do. So you have to be prepared to either redose them or you have to go with a different tactic. Something like triple drip to maintain anesthesia can work well. I'm not going to get into details of all of these things, but I just wanted to kind of mention that field anesthesia in donkeys can be a little bit trickier just based on the way that they metabolize drugs. And this is just a table to kind of show you some of the drugs I just mentioned that might be used for sedation or anesthesia in donkeys and some notes about them, but I already basically went over the main points shown in this table. The fact that most drugs can be dosed the same as for horses, but that donkeys metabolize ketamine a lot faster. That's especially true for miniature donkeys. And then this is a table that shows some of the common pain medications that we might use in donkeys and some notes about them. But before administering any of these medications to your donkey, please make sure that it's under the direction of your veterinarian. They're not without risk. So when we use most of the common pain meds at similar dosages to horses. But just as I mentioned with the sedation drugs, some of these drugs are also metabolized faster in donkeys too. So for instance, bute is metabolized faster. likely needs to be given at least twice a day, maybe even more than that in miniature donkeys who metabolize it really fast. Again, only under the direction of your veterinarian because it's not without risks. Banamine is cleared at a similar rate actually in donkeys as it is in horses and might have fewer side effects for long-term usage. And then others like furocoxib and meloxicam, they are metabolized really fast in donkeys. Okay, so now I just want to talk for a minute about some of the challenges with actually gaining access to the jugular vein in donkeys. So in the horse, the procedure to kind of raise the jugular vein up and visualize it before we poke them is pretty simple. This is a photo from an anatomy lab that shows a donkey that has had the skin removed to kind of show you the extent of the extent of a muscle that overlays this jugular vein. So the head's at the top of the screen. The person is holding this muscle that runs right over that jugular vein, and it's called the cutaneous coli muscle. In horses, they have this muscle too, but it's a lot thinner. It passes over kind of the bottom portion of the jugular vein, but it doesn't extend over the entire jugular groove like it does in the donkey. So in the donkey, it's a much thicker muscle. It extends over the entire jugular vein, and it also gives them the ability to really tense the skin when you go to touch them and try to get the vein to raise up. So that's a problem. They also have a thicker skin. So that combination of really thick skin, this really thick cutaneous coli muscle, really necessitates the use of kind of more angle when you go to stick the needle into the jugular vein. It means you're probably not going to see the vein that well. So you're going to be, kind of going based on feel and your knowledge of where it should be. And you're going to have to use more angle when you go to poke it in. And, it can help to kind of habituate them a little bit by scratching or pinching in that area before you poke them. Similar to horses, they're not going to tolerate probably lots of pokes with good graces all the time. And then to insert, if you have to insert an IV catheter in a donkey, again, you need good restraint. So think about tying them up. This is kind of a picture that shows tying that donkey's head kind of high and pretty short. They tend to do pretty well with that kind of restraint for the most part. You probably need a catheter that's at least 3.5 inches in length, again, because thick skin, thick muscle. And you're going to need to use increased angle when you go to insert it. You can use lidocaine to try to numb the area. So you can either, apply lidocaine in the skin, or you can sometimes even use the lidocaine cream, the transdermal lidocaine, but that does take about 20 to 30 minutes to take effect. All right. So in many instances, when you're dealing with an emergency in a donkey, maybe the donkey is just kind of off, not quite right, dull. Remember, dull donkey is an emergency. Blood work is going to be indicated. So we already talked about the first challenge when it comes to blood work, and that is getting the sample from the vein. That's not always easy. The next challenge is interpreting the results. So the normal reference ranges for donkey blood values can vary a little bit from those that are established for horses. So it is important to realize that, hopefully use a lab that has maybe donkey specific reference intervals. Remember that, again, donkeys are desert adapted animals. So take care when interpreting the packed cell volume, the PCV in donkeys. So PCV is a measurement of basically the percentage of red blood cells. And we use that in horses oftentimes to assess their hydration status. A donkey's PCV is minimally affected from fluid loss until they are quite dehydrated. So it doesn't usually change much until they're 15 to 20% dehydrated. So it just means that as veterinarians, clinicians, we have to be careful that we're not misinterpreting a normal PCV and saying, oh, okay, that donkey's not dehydrated based on that, because that might not be the case. The second major consideration for blood work in donkeys that I want to point out is that you should always, always, always make sure to run a triglyceride concentration. So a lot of panels don't necessarily include triglycerides. you have to make sure that if you're running blood work on a donkey, you are including triglycerides in every sick donkey. If triglycerides are elevated, that is called hyperlipidemia. And that can quickly progress to a condition called hyperlipemia, where the donkey basically starts depositing fat abnormally in organs, and it can lead to organ failure and eventually to death. So it's important to run triglyceride concentrations. You get an actual number that you can look at, and you can use that value to try to gauge your treatment approach, and also to give you some idea of a prognosis as well. So the blood tubes on the left and in the middle show plasma and serum that are really milky white. That is abnormal. That is indicative of hyperlipidemia. The plasma or serum should look more like the picture on the blood tube on the right, which is kind of translucent and yellow. That's more normal. It should be clear, not milky white. But even if it's not milky white, it can still have elevated triglycerides. It could still be in the early stages of hyperlipidemia. So it's still important to check, even if it doesn't grossly look abnormal. So a donkey who's not eating or not eating that much is an emergency. And that's because when they don't eat, whether that's due to some concurrent disease process, bad teeth, colic, whatever, some other stressor, their body quickly goes into a state of negative energy balance. And that triggers this series of events that's depicted in this chart. I'm not going to spend time going through this chart in detail, but basically it triggers the donkey's body to start breaking down fats. That's called lipolysis. And this releases free fatty acids into the bloodstream, and those get turned into triglycerides. And that's what we measure in the blood. That's what I was showing you in the previous slide. It quickly becomes a vicious cycle that we can't easily turn off without getting the donkey out of that negative energy balance. And if we don't turn it off, then it results in hyperlipemia. They start accumulating fat in organs, and that's when we have, other major issues. So this is a secondary issue. It's triggered by some sort of a stressor or some underlying disease process. So we've got to correct this. We also have to look for the underlying cause of the disease and correct that. And the picture on the bottom right shows like mucus covered feces. So donkeys can pass feces that are covered in mucus when they're hyperlipemic. They don't always, but they can. And then again, there's a picture of a blood tube with that milky opalescent serum. So what are some risk factors for hyperlipemia in donkeys? There are lots. The biggest one is concurrent disease, and it can be anything. But they can be at increased risk just as they get older. If they're obese, females are at a higher risk. If they're pregnant or lactating, if they're being fed grain, there's lots of different risk factors. And the clinical signs, by far the most common, is just dullness. Again, maybe you note them to not be eating that much, or they're sham eating. Maybe they have reduced fecal production because they do have reduced gastrointestinal motility, or they're producing the mucus-covered feces. Here's a chart that shows how that number, that value that we get when we measure triglycerides on our blood work, can be used to help guide our treatment approach and our prognosis. So when that triglyceride concentration gets up beyond like 1,300, the treatment becomes more challenging and the prognosis becomes more guarded to poor. So the more early cases can often be treated just by encouraging the donkey to eat, goodies. Like that's when we break the rule and we start giving donkeys treats of all sorts, apples, cookies, whatever you want to eat. I'm going to give it to you just to try to bust out of this negative energy balance. But as it starts to creep up, we start to need other more invasive kind of treatments, nasogastric intubation, IV fluids. Eventually, as you can imagine, this is something that requires hospitalization and careful monitoring. So it's really good to catch it early. All right, so now I just want to go over some emergency relevant information by certain body system. We're not going to hit every body system, but just a few that make the most sense. So starting here with the oral cavity, donkeys with dental problems are at a much higher risk of developing colic and also esophageal choke. So they, just like horses, they need their teeth checked regularly. And as with most things, as you can probably imagine by now, donkeys can have pretty severe dental disease without showing a lot of clinical signs. So, you might see them quitting, dropping their feed, but oftentimes you don't. You might see weight loss, but oftentimes you don't. So it's worth having someone check their teeth on a regular basis. And this is a book that you can download for free from the UK Donkey Sanctuary if you're interested in learning more about everything related to donkey dentistry. All right, so when it comes to donkey dentistry, a thorough oral exam is the place to start. And oftentimes that starts with an external exam first. So this is a picture of Dr. Rodriguez from the UK Donkey Sanctuary who's demonstrating some of that. So he starts off here in the bottom picture. You can see he's applying pressure to like the outside of the cheeks just to try to see if there's any pain response elicited as he pushes the cheeks against those cheek teeth. Now, I've talked to you at length now about how donkeys don't show pain in the same way that horses do, but when it's really acute, severe pain that you've elicited, they will show a response. They will kind of try to turn away or elicit some sort of a response similar to a horse. In the top left picture up here, he's trying to just check for pain in the area of the tongue by applying pressure in that area. And then in the top right picture over here, he's checking for any pain in the area of the temporomandibular joint, so just behind the eye, to see if he can elicit any sort of a pain response when he palpates that area. And then finally, he's putting a speculum in the mouth and doing a thorough oral exam with a speculum in place. So that's kind of how we go about checking, doing an oral exam on a donkey. So now as we move further down the GI tract, we need to talk about colic. Just like horses, donkeys can suffer from colic as well. Increasing age, dental disease, grain diets, reduced water intake are just some of the risk factors among many for donkeys to develop colic. And unlike horses, you might already have guessed, donkeys might not show much in the way of clinical signs. So this is a picture, for instance, of a donkey who's colicking. They might just kind of act dull. I think you're probably catching on to the theme. So even sometimes if they have a colic that is surgical in nature, that's going to require surgery to fix it, in a horse, in those instances, you would see usually pretty dramatic signs of pain, like rolling and flank watching and pawing. If a donkey shows that, it is an emergency, but oftentimes they won't. They might just lie down, be recumbent more than usual, or just look dull. And as I already mentioned, using some of the parameters that we're used to using for assessing dehydration, like PCV, might be misleading in a donkey. So I do recommend, listening to the heart. If the heart rate is elevated above 70, that's likely indicative of some pain, possibly severe disease. So that is definitely worth a phone call to a veterinarian and worth a workup. All right, so another consideration for donkeys who are colicking is the fact that they have narrower nasal passages than horses. And this is important because we as veterinarians tend to need to pass a nasogastric tube or an NG tube when we're doing a workup on a colic. And so in a donkey, we need to be sure that we're using a small tube. So this is likely one that's made for a foal or a pony. Those are the ones that work best in most size donkeys. Another thing to consider when you're passing a nasogastric tube in a donkey is that they have a prominent pharyngeal recess or a blind pouch that's located kind of at the back of their throat. It's likely that this recess is somehow involved in the bray, the call that they make. This picture in the middle, I realize it's not a fabulous picture, but it's a cross section of a horse on the top compared to a donkey on the bottom. And this purple arrow here is pointing to this blind pouch. That's the pharyngeal recess. And so you can imagine as a veterinarian is trying to pass a nasogastric tube, if they get to that level and it stops, they can't go any further, they've likely passed it into that pharyngeal recess. And so if you get stuck at that point, don't panic, just back it out a little bit extend the neck and try to redirect into the right place. And then this picture on the right is an anatomy dissection of the donkey's throat. This is the larynx. And this area above the larynx here, that dark triangle, that's the pharyngeal recess. So that's where that NG tube can get trapped if we're not careful. Another important consideration when we're working up a donkey who has colic is to understand that even outwardly appearing thin donkeys can have really extensive, thick fat pads on the ventrum of their belly, in the abdominal wall area. I mean, this can be like 4 to 6 inches thick. It can be really crazy. And this becomes important because sometimes as veterinarians, we need to get fluid from the abdomen. That's called a belly tap, to try to better assess the nature of the colic, try to determine if the colic might require surgery or not. So you can imagine that it might require a little more nuance and maybe an ultrasound to try to determine where you can go to get that fluid. And you might need a long needle, like a spinal needle, in order to get through a pretty extensive layer of fat, if that happens to be the case. So ultrasound can come in handy so that you make sure you're avoiding the intestines and everything else when you go to take that belly tap. Just a few more notes about the GI tract of donkeys that might be relevant in emergency situations. So donkeys require a really fibrous diet. Again, that goes back to their desert origins. They also tend to have decreased abdominal tone, and they have a tendency for fat deposition, as I mentioned, in their ventral abdomen. All of these things contribute to a more pendulous abdomen, okay? So that hay belly appearance in donkeys is normal. And so we shouldn't mistake that for abnormal, abdominal fluid or some other pathology. Pendulous abdomen is usually kind of a normal thing in donkeys. They tend to have a slower gastrointestinal transit time. Things move a little bit slower. That also contributes to the pendulous abdomen appearance. And in part, that is due to a slower transit through the stomach, a delayed stomach emptying compared to horses. That can be important to know if you have a donkey who needs to have gastroscopy, where they're passing a scope into the stomach to look for stomach ulcers or something like that. You need to be aware that it can take longer for the feed to leave the stomach in a donkey. Additionally, when donkeys suffer from impaction colics, the most common site that we see those is the large colon. And oftentimes in horses, we hold them off feed to try to get them through that. We have to be more careful doing that in donkeys because of their propensity, again, to develop hyperlipemia. So it's a balancing act, checking triglycerides, maybe offering a little bit of grass or something, so they don't develop hyperlipemia. Okay, so moving now from the GI tract to the liver, we already mentioned one way that the liver is involved in many donkey emergencies, and that is with fat breakdown, fat accumulation that we see with hyperlipemia. So I'm not going to talk about that really in much more detail, just to say that blood work can be super important if it's suspected. You should contact your veterinarian as soon as possible because, again, early intervention and treatment is really critical. And treatment might, in many situations, require referral to a hospital if it's progressed. And if you want more information, that paper that I've listed here goes into some real details, more details surrounding treatment considerations and approaches for hyperlipemia in donkeys. Aside from hyperlipemia, though, other issues that end up being emergencies in donkeys can also involve the liver. For whatever reason, donkeys seem predisposed to chronic liver disease, which we call liver fibrosis, when they develop scar tissue in their liver. And sometimes those can, oddly enough, even though it's a chronic, kind of insidious, long, lasting situation, they can present with kind of sudden onset of clinical signs. And as with most things, they might just present with some dullness, or you might see other signs of liver disease like icterus, which is when mucous membranes turn yellow, or blindness or neurologic disease. Sometimes you might see fever or weight loss. on blood work, you might have elevations in liver enzymes. You might not. If there's extensive scarring, the liver might not be producing excess or leaking excessive enzymes anymore. So you can be tricked with that sometimes. And sometimes this requires ultrasound imaging of the liver, plus or minus biopsy to diagnose. The underlying etiology of liver fibrosis is still kind of a mystery in donkeys, and there are luckily researchers here at Cornell who are working on this and elsewhere trying to solve that mystery. Okay, moving on to the respiratory tract now. It's worth noting that donkeys have a pretty insensitive cough reflex compared to the horse, which allows for more subtle respiratory pathologies to kind of go unnoticed in the early stages of the disease. And that also means that if you do have a coughing donkey, that donkey might have more severe disease. So it's worth having a veterinarian examine the donkey if you do note coughing. They're also more likely, at least anecdotally, this is true, more likely to develop pneumonia secondary to infection with the flu than horses are. So I do recommend vaccinating donkeys for influenza. I think that's really important. Donkeys are also susceptible to equine herpes virus, and they also are susceptible to a whole bunch of asinine herpes viruses as well. So these viruses can cause respiratory disease. Sometimes they can also cause neurologic disease or sometimes abortion, depending on the specific virus. So it's worthwhile to vaccinate donkeys for EHV1 and 4. That's the rhino portion of the rhino flu vaccine. It may or may not have any cross protection to those other asinine herpes viruses, but there's no vaccine available for those asinine herpes viruses. So we do the best we can protect them for the ones we can protect them from. Donkeys, especially older donkeys, are also prone to tracheal collapse, which can lead to increased inspiratory effort, so more difficult time getting air in. The picture on the top shows a collapsed trachea in a donkey, so you can see that what should be a nice round circle of an airway is actually kind of a narrow flattened slit. These donkeys are not, donkeys in general here in the US are not usually major athletes, so they're unlikely to show clinical signs of respiratory distress associated with these tracheal abnormalities unless they have some other concurrent lung pathology or unless they're, subject to work. So also remember, if a donkey needs to be scoped to work up a respiratory disease, you're going to need, because of their narrow nasal passages, you're going to need a small bore endoscope in a donkey. Donkeys can get asthma as well, and that can present as an emergency with severe difficulty in expiring and getting air out. And that's often due to an exacerbation of like a chronic process, usually related to some environmental allergens. And then pulmonary fibrosis or scar tissue in the lungs, that's shown in the bottom picture. That can also be fairly common, especially in older donkeys, and that should be considered as a differential for any donkey in respiratory distress. And we don't know the underlying etiology of that yet either. It could be some of those asinine herpes virus infections, could be a bacterial infection, or maybe allergen exposure. Okay, moving on to the feet. Part of the musculoskeletal system, it's really important to understand important anatomical differences between donkeys and horses, because emergencies involving the feet can be common, and understanding the differences in anatomy is really key to making the appropriate diagnosis and providing the right treatment. So in each of these pictures, the donkey foot is on the left, the horse foot is on the right. Donkey hooves are more upright than horses, as you can see in that top left picture. The coffin bone is located deeper down in the hoof capsule, more distally in the donkey compared to the horse. Hopefully you can appreciate that in that bottom picture. This is really important when we're interpreting x-rays, when we take x-rays of donkeys' feet. Veterinarians need to use donkey-specific parameters to assess those x-rays to determine whether that coffin bone has sunk or not, which can happen with laminitis. And also the point or the apex of the frog in donkeys does not extend as far forward as compared to the horse, which hopefully you can see in that top right photo. That means that Heart bar shoes, which we might use in horses with laminitis to offer support, are actually contraindicated for use in donkeys with laminitis because they don't provide support where they're needed. And instead, they might actually end up acting as a fulcrum in a donkey. So speaking of laminitis is oftentimes in donkeys, it's associated with donkey metabolic syndrome or Cushing's disease. It's a really common cause of lameness in donkeys. They, as you might have guessed, often can present pretty subtly, sometimes just with kind of shifting weight, short strides, maybe more recumbency, lying down more frequently than usual. They don't often present with that classic rocking horse stance that's so common in horses. I put a picture of a donkey showing that in the top left. That donkey's on a concrete floor. So if you put them on a really hard surface like that, then you might see that more classic stance. But otherwise you may not. And because it can affect their ability to get up and get to their feed, you might end up with hyperlipemia as a secondary sequela to it. So you have to ensure that you get treatment quickly and get them feeling better quickly. So treatment in the acute phase usually hinges on providing a lot of cushion, thick cotton pads or styrofoam blocks, deeply bedded stalls, and pain relief. And then making diet changes or adding other treatments depending on what the underlying issue is. And this radiograph on the bottom is a picture from a donkey who had really severe chronic laminitis, which you can hopefully tell that coffin bone is rotated. It's really deformed. There's a lot of bony changes that happen to that bone as a result of the chronicity of the laminitis. And that donkey was really hardly lame at all, which is super surprising. So it can be hard with donkeys to really convince owners that they're in a lot of pain. They just don't necessarily always show it the same way. But sometimes radiographs or other diagnostics can give us a lot of information that can help us assess the quality of the life of the donkey. Other common foot diseases in donkeys that may present with lameness are abscesses and white line disease. While you might not consider these emergencies, like everything else, they can interfere with donkeys' daily activities, sometimes with them getting up and eating. So we need to address these issues. Abscesses are a really common cause of severe lameness in donkeys. So much like horses, when a donkey gets an abscess, it's an acute, severe pain. They often usually present kind of three-legged lame, similar to a horse. Hoof testers, though, are rarely useful for localizing an abscess in a donkey because they have really hard hoof capsules, they have thick soles, and it just makes it difficult to elicit pain with the hoof testers reliably. In addition, that thick sole means that the pus from an abscess likes to travel up and break out in the coronary band, oftentimes rather than busting out at the sole. So abscesses can be tricky in donkeys, and I usually recommend, if you haven't found the abscess within a couple of days, it's worthwhile to take an X-ray to try to get more information about what's going on. White line disease or seedy toe is rarely super painful. That's basically an abnormal separation at the white line, and you can get foreign material like rocks and things in there. You can get bacterial and fungal infections, and it can become painful. It can result in infection. The donkey hoof wall, again, going back to their desert origins, is capable of absorbing much more water than the horse, and that is likely, a desert advantage, but not an advantage at all when you're a donkey living in Ithaca, and it makes them more susceptible to white line disease. So treatment is aimed at debriding all the affected horn, rebalancing the hoof, providing dry, clean bedding. And due to the fact that they have different hoof wall loading patterns in horses and they have thick soles, they can cope quite well with really extensive debridement of the hoof wall, similar to that picture in the bottom there. And of course, that would have to be kept really clean and dry while it grows out. Last system I want to mention is the nervous system. For the most part, things are not much different between donkeys and horses, except that the examination can be a little more challenging sometimes in donkeys. When a horse or a donkey presents with neurologic disease, a veterinarian has to examine them, try to determine where in the nervous system the lesion is. This is called neurolocalization, and neurolocalization of lesions in and of itself is not different, but performance of the exam and response to certain tests can differ a little bit. So just be aware, donkeys don't reliably exhibit a menace response. That's a test that we perform to try to assess whether or not they have vision. And the dynamic component of the neurologic exam in donkeys, where we try to get them to move in certain ways, is often complicated by their reticence to move in a new or stressful, environment. So allowing a donkey to move freely in a closed-off pen might be necessary for assessing the donkey's gait, determining whether they're ataxic or weak or anything like that. And then, as I mentioned, they are susceptible to a number of both equine and asinine herpes virus infections, and some of those can cause neurologic disease like EHV1 and AHV3, that's asinine herpes virus 3, which is also called equine herpes virus 8. Very confusing. Lastly, and sadly, I just want to mention a few quick notes about euthanasia in donkeys. It really involves the same basic techniques as for horses. When barbiturate drugs are used, they're given at the same dose. However, one of the challenges in performing euthanasia of equids may be the lack of suitable drugs available or the limited options for disposal of the carcass in a safe manner, because when you use barbiturates to euthanize an equid, you do have to make sure that they aren't going to be eaten by scavengers or anything like that. When used, though, it's necessary usually to put in an IV catheter. They can have a thick coat, so you probably want to clip to help you with your visualization, which I already mentioned is a little tricky. You can numb the area using lidocaine, as I mentioned, before you insert the catheter. Again, you probably want a 14 or 16 gauge catheter, at least 3.5 inches long because of thick skin, thick muscle. And you're going to need to use more angle, kind of almost similar to your approach for a cow. When use of barbiturate drugs is not an option, then use of captive bolt or gunshot might actually be appropriate. For donkeys, the site for the captive bolt or gunshot is 1 to 2 centimeters above an intersection of 2 lines drawn between the outside corner of each eye and the base of the contralateral ear, as I've shown in that top left picture, which is just slightly higher than the points for horses and ponies. So for horses, the site that you're aiming for is about 2.5 centimeters above an intersection of 2 diagonal lines from the inside corner of the eye to the base of the opposite ear. Alternatively, similar to horses, intrathecal lidocaine can be used in the atlanto-occipital space. The practitioner would have to make sure the animal was under a surgical plane of anesthesia to use that method. And most importantly, this is a big difference. Most importantly, if the donkey has a bonded companion, that companion should be allowed to really come to terms with the death of the donkey. So oftentimes that entails leaving the body of the euthanized donkey in an accessible location until that companion donkey has lost interest. That can take several minutes to several hours. It can cause distress to the owner, but it will minimize stress in the donkey who's left behind. And that can be really important because remember, any stress in a donkey can sometimes result in hyperlipemia. So you want to try to minimize that so you don't end up with a hyperlipemic companion donkey left behind. So in conclusion, understanding donkey behavior is absolutely key to identifying an emergency situation and dealing with it appropriately. Donkeys are stoic creatures, and they can mask a lot of clinical disease. Hyperlipemia is a risk for all stressed or sick donkeys. You want to prevent it whenever possible, identify it as early as you can, and manage it appropriately. Early intervention is absolutely key. If you ever have any questions, it's best to send videos or pictures to your veterinarian. If you think it's an emergency, you know your donkey best, and you need to be an advocate for them. They may just be a little off, but identifying an issue early on can really be life-saving. And so with that, I'm happy to answer any questions.
Thank you very much, Dr. Goodrich. That's an adorable picture. I love him. So there are some questions, some good questions. I'll get started. We have a few minutes, so let's get to as many as we can. This is a good basic question to know. What's a normal temperature range for donkeys? And when do you start getting concerned about fever?
Yeah, so I do have a slide I can go back to really quick, sorry.
That's okay.
Um, that has the normal temperature, pulse, and respiration rate, and it's good to kind of have those. So they vary a little bit depending on whether, it's an adult donkey or a younger donkey. But this is kind of the normal temperature. So just maybe a little bit lower than what is normal in horses and mules, but not much. So 97.7 to 99.9 is pretty typical. They can be a little more thermolabile, I think, than horses are. So if it's really cold outside, they might tend to run more on the lower range.
Mm. That's good to know, certainly. And I would also add, everything she's saying, you should also ask your vet. Just,
Absolutely.
know your own horse, donkey, equid, and also always ask your vet. Um, so someone else is wondering whether EPM, equine protozoal myeloencephalitis, can be a risk for donkeys or not.
I would imagine it could. The last time I did a literature search, I couldn't find anything in the literature, but that does not mean anything about about
Sadly,
it
right?
not being a risk.
Yeah.
Because oftentimes people just don't take the time to write up case reports about donkeys. So I would imagine it can. I know there are people who are studying that a little bit in mules.
Oh,
But I bet it can affect donkeys and mules as well. So
hmm.
yeah.
Always keep it in mind, I guess, right?
Yeah.
Um, so this is a good question, I thought. Where can someone find some parameters for taking good hoof radiographs if they're working with a farrier and their vet?
Oh, that's a good question. There are actually, and I didn't put them in my talk, but there are papers out there. Um, Researchers have established like the very specific measurements needed for donkeys compared to horses.
We can send out follow-up resources to anyone who registered, and we usually do. So that can be one thing we include if people are
Yeah.
interested. Okay, so we can link to those. Um, so this is I think a good question, and it's something I've often wondered is, okay, you have a dull donkey. At what point do you start to worry? Kind of a timeline. So is
Yeah.
it different than with a horse, or is it like as soon as they seem off, you're supposed to call? Is that different at all?
Yeah, I think because donkeys are so stoic, they're likely, and it also depends on how their relationship with you, I would say, right? So like my donkeys trust me a lot. They don't see me as a stranger. I think they're probably less likely to do that sham eating thing. Um, so it depends on how well you know your donkey, but really, if you feel like they're not eating well or not eating, that's an emergency. And I wouldn't hesitate to call your vet and just at least get that initial blood work, maybe just check a triglyceride concentration, make sure it's normal. Because best case scenario, it's normal and it was just, donkey was having a bad day and everything's fine. But worst case scenario, triglycerides are trending up and we're already kind of behind the 8 ball and trying to play catch up, and then it gets difficult.
Mm. That's a good rule of thumb. I like that. So how about someone's asking how long is it okay to leave the companion for a show or event with the other donkey?
I think that's probably a, individual donkey thing. So if they're a super bonded pair, any time away is probably going to induce stress. And I can't say for sure how that stress will, whether that stress will be enough to result in that lone animal not eating and developing hyperlipemia. It's hard to know. So really it's kind of an individual pair situation.
That makes sense. Yeah. And then one last question. We're coming up on 7:05 here. Is fatty liver disease in cats similar to hyperlipidemia in donkeys, if
Yeah,
people have heard
it
of
is.
that?
It is a lot similar. Yep.
So yeah, if you've dealt with that in a cat, then you're familiar with how scary that can be, and
Yep.
you know,
It's a vicious
similar
cycle.
issues.
It's
Yeah,
hard
yeah.
hard to get, hard to shut it off once it starts.
Exactly. Yeah. So in short, dull donkey, call the vet.
Yeah.
Donkeys are different. And
Yep.
you're getting a lot of thank you messages as well. And for anyone who asked about any resources or anything, we're going to send out some follow-up ones. We'll include those hoof radiograph resources. And then also, if you had some more general questions, non-emergency, but just about caring for donkeys in general, Dr. Goodrich's previous talk is on our playlist. So if you had questions, especially about diet or natural history or any of that, then that would be a good place to look.
Yeah.
And we'll send out the recording. I'm gonna guess it'll be after the holidays. I don't think they'll be editing the YouTube video next week. But we thanks everyone for coming, and thank you, Dr. Goodrich.
Thank you. Thanks for the opportunity.
Thanks, everyone. All right.
All right. Bye.
Thanks so much. See you later.
See ya.